the collective state of Arizona and those beyond to a place of safety, to a place of trust, so that we can share the impact of COVID on the Black community specifically. And you'll hear us say Black and African American interchangeably. We're talking about the entire diaspora of Black people in either of those. And so I'd like to welcome you as well on behalf of Mayo Clinic. As I have thought about the purpose for doing this, it's really about community. And if we don't take care of ourselves, no one else is going to take care of us. And so right in the middle of the word community is you and I. Without you and I, it is not community. That is why it's vitally important for us to share in this manner, not just to provide education to you and talk to you, but to also get feedback from you about what it is that the Black community needs in order to lessen the health disparate outcomes that we see for COVID-19, but not just COVID-19. Every other disease, you will find that people of color are impacted more gravely by the disease for multiple factors, in which you will hear later in the program. So I'm looking forward to the interaction, and it is my pleasure for me to introduce our moderator for the evening. Dr. Eula Saxon-Dean is a trusted community leader and educator, and she has agreed to be our moderator for this evening. Dr. Dean, welcome.
Thank you very much, Marion. And also thank you to Dr. Michelle Halliot, for both of you for planning and really pulling this team together, as well as thank you to Dr. Sandra Kennedy for her leadership in the community. Good afternoon to our family and friends of the African American community. I am sitting in my kitchen this evening for a special reason, because when there are points of interest and critical issues in the African American community, we join together as a family. And the most common place we come together is around our kitchen table. And so I hope that you feel comfortable joining me at my kitchen table, because it is important for us to join with key leaders in healthcare this evening and other community leaders for a candid discussion that highlights the underlying conditions that put our communities of color at risk to health and well-being. We hope that you will have an opportunity to learn about the direct impact of COVID-19 on the Black community. And also, you will learn ways to lessen the impact of the disease so that it doesn't impact you and it won't impact your family. And we will learn more about how we can work together as a community so that we can develop a call to action. Remember, we stand as a community in this greater metropolitan Phoenix area, but we do not stand alone. We stand together as an African American family. So a very heartfelt thank you for joining in on the virtual African American Town Hall this evening. This is a time for us to listen. And so I'm going to invite you to take notes. There will be lots of information that will be shared from the experts that will be providing information this evening. If you have any questions, you've already been instructed of how to draft and where to draft your questions. If you're not sure you can get your questions in tonight, you still will have time, because I understand that you have Marion's email. So feel free to send that question in. Our goal tonight is to inform ourselves so that we can live longer and we can carry on the legacy and the history of excellence and goodwill of our African American families and our communities. So this evening, as we learn from experts, let us focus on the fact that we need to preserve a future for ourselves and for our children. Remember, there was a poet laureate that said it in some very special words. You and I may not say it just like Maya Angelou. She said it like this: you may write me down in history with your bitter, twisted lies. You may trod me in the very dirt, but still, like dust, I rise. And only our brother James Weldon Johnson could echo a call and response with these historic words. Stony the road we trod, bitter the chastening rods, felt in the days when hope unborn had died. Yet with a steady beat have not our weary feet come to a place of which our fathers sighed. We have come over the way with tears that have been watered. We have come treading our path through the blood of the slaughtered. Out of our gloomy past, till now we stand at last, where the white gleam of our bright stars cast. And so now I'm going to ask you to do something very simple. I want you to just focus. And I want you and I to turn to our faith. And I want you and I to just go deep inside of ourselves as we listen tonight and call on that spirit of hope. And I want you to find that armor of wisdom and knowledge as we begin tonight. If you have not done it before tonight, now is the first step to prepare ourselves so that we teach our children, we teach our parents, and we teach our grandchildren and everyone around us how to take care of ourselves so that we live a marvelous future of excellence and prepare a way for our children. This will begin tonight. Let me now take time and introduce the wonderful panel that you will be hearing from. I believe our first speaker this evening is Mr. Clovis Campbell, and he's the chair of the Commission of African American Affairs. We will then hear from a team that includes Dr. Edmund Baker, Medical Director of Equity Health, Dr. Angela Allen, Clinical Instructor, Arizona State College of Nursing and Health Innovation Scholar. We will also hear from Dr. Brittany Parker, hospitalist from the Mayo Clinic, as well as Dr. Chaik Dalbany, Chair for the Center of Health Equity and Community Engagement and Research from the Mayo Clinic. Ladies and gentlemen, I want you to lean in. There is great knowledge to be learned and shared this evening. Let us hear now from Mr. Clovis Campbell.
Thank you, Dr. Dean, and thank you all for attending and listening in on this important and most valuable piece of information about COVID-19 in our community. Again, my name is Clovis Campbell. I'm the Executive Director for the Arizona Commission of African American Affairs. Briefly, the commission was created to be a liaison between the African American community and the three branches of state government, the legislative branch, the executive branch, and the judicial branch. We're partnering with the Mayo Clinic to do this and other programs to ensure that our African American community gets the best information they can in regards to COVID-19 and Arizona's actions. What I'll be doing is going over a few things. There is a full list of what Arizona has done, being one of the top states to move quickly, move efficiently, and move to keep our citizens safe as we fight this pandemic. So if you can, take a look at what we have at our azgovernor.gov list, and you'll see what just Arizona is doing. You'll see some things listed here. I'll go over a few of them as you see the pages scroll through. Starting with our Health and Emergency Center that was activated in January. Arizona was there to monitor the situation locally and nationally. You can move forward with the next slide. As you see, March 2nd, we started our state test labs. March 11th, we declared some health emergencies. March 12th, we passed some new state public fund health funding. Next slide, please. March 15th, schools closed. March 16th, we issued new guidance, counseling gathering. March 19th, a couple of things happened, including that they released new guidance for dining establishments and other businesses. Real important because we want to make sure that people are safe when they eat. March 20th, 21st, 23rd, several other executive orders were passed, including the one most important that secured PPE for county health departments. Next slide, please. March 25th was a special period that we requested special healthcare enrollment. The governor did. And on March 28th, which is real important, the state legislators signed bipartisan budget agreement, which is something that's really tough to do. As we move into April, you see in April, we allow people to allow for them to have prescriptions refilled without having to see a doctor. April 7th, the executive order to expand more COVID-19 data gathering, which is important to make sure we know how many people are ill, how many people died, etc. April 9th, we received approval from SNAP purchases for USDA. And April 22nd, the governor has issued the removing restrictions on elective surgeries. Next slide, please. We're waiting to see what happens. We know that May 1st is our deadline as far as to remove the closures of businesses and open up Arizona a little bit more at a time. There may be some changes coming up. If you go to that website, if you go to our website, which is listed above, if you go to my email address, you can send me information as well. So if anyone has any questions, I look forward to hearing from you. But just remember that the state of Arizona is working real hard to keep our citizens as safe, and particularly our African-American citizens. Thank you.
Good evening, everyone. My name is Dr. Edmund Baker. I'm the medical director at Equality Health, and I will be moving into some of the education part of this presentation. I will start by explaining what this virus is. I give a brief overview of how it spreads, and then we will discuss who's at risk for bad outcomes from this disease. We will touch on why African-American community has been affected differently, an important item, when and where to seek care. Next slide, please. So for those who don't know what this is a cartoon depiction of the virus. The name of this virus is SARS-CoV-2. That's the government name. It's never been seen prior to December of 2019. It belongs to a family of viruses called coronaviruses. They got that name because of the crown-like appearance when you look at it under a microscope. Coronaviruses usually cause mild flu-like infections, but there have been several of them that give more severe diseases, like the SARS-CoV, original SARS virus, which happened in China in 2002, and the MERS virus, which happened in 2012. This virus causes the disease COVID-19, which is coronavirus disease 2019. This slide shows how it spread. We have to understand viruses are not alive. They sit around waiting on surfaces for the host to pick them up and place them into an environment which they can replicate. This virus most commonly uses the mouth, the nose, and eyes of the human to enter the body. This happens because the virus is left on surfaces by an infected person. When they cough, sneeze, or touch surfaces, they leave respiratory droplets that are filled with viruses all over the surface for the next person to pick up. Very important. The virus typically does not travel more than 6 feet. However, in certain circumstances, it could travel farther, like when people exercise or sing because they're forcing air out more forcefully. And the longer you stay around an infected person, the more chance you have of picking up the virus. Next slide, please. So the best way to control the spread of the virus is creating a space between us, staying at home, and evaluating yourself from time to time for signs of the infection. We'll talk about those signs on a few more slides later. Quarantining or isolating yourself if you're sick. That means putting yourself in a separate part of the house and using protective equipment to keep those who you love safe. Next slide, please. Very important slide. I want you to look at the image there. The goal of the stay-at-home initiatives and social distancing is to flatten the curve. If you look at that red curve, the disease, if left undaunted or without any procedures in place, the disease will have a really high rise above what the healthcare system can maintain, right? So the goal is to, when you put these processes in place, such as social distancing, you start to flatten that curve down, and so that the system is not overrun with sick people. The virus has gone from its first patient in Wuhan, China, to the global pandemic that we know today. So Dr. Allen will come on and tell us more about those numbers.
Thank you, Dr. Baker. Now let's look at the numbers that are listed before you. These numbers are actually related to the COVID-19 and the statistics that we've actually heard throughout these weeks. As of April the 26th, and we know these numbers have increased since then because we are in the April the 28th day, the world reported over 2,900,000 confirmed cases and over 200,000 deaths. On average, we're looking at an increase of about 3% confirmed cases as well as 3% deaths. The United States reported nearly 1 million confirmed cases and over 52,000 deaths. Now, the United States makes up about 25% of the total number of the deaths reported throughout the world. Yet in the state of Arizona, over 6,500 cases were identified with 275 deaths. There was no significant recent increase, if you will, in the deaths, because we are looking at actually as of the 26th through the 27th, we've noticed that that number has not changed. But yet we have identified an increase in the confirmed cases. And we contribute that to the testing that is going on now throughout the state. As related to the Maricopa County, which is actually the nation's fourth largest county, in terms of population, we see that it's over 3,000 confirmed cases, but yet 121 deaths. Next slide, please. Now, who's at the highest risk for serious illnesses? This is something we've heard throughout our times, of course, listening to the information that's been shared to us. We expect about 80% will recover from the disease. That is a large number. So this is something that we want to reassure you that there is a high percentage, which we don't hear a lot of those who actually recover from the disease. But about 20% who are at highest risk are those 60 years of age or older. Why, you ask? This is because those who are 60 years of age or older have what we call multiple comorbidities or multiple long-term diseases, as well as multiple use of medications related to those long-term diseases. In addition to those who are 60 years and older, we also look at those who are under 60 years of age, and we identify that contribution to the chronic diseases those individuals may have. We also look at those who are immunocompromised. Now, immunocompromised, when we think of that term, we look at those who may have been cancer patients, HIV, those who have recently had transplants, and then, of course, those who have been on steroids for a longer period of time. Next slide, Pete, please. Disparity in medicine. We've heard this quite a bit. Disparity in medicine is another term for different treatment in medicine. Because African Americans have a higher risk of those comorbidities or those long-term diseases such as heart disease, lung disease, diabetes, and others, we also identify that African Americans have a high poverty rate. There may be an increase of the lack of adequate healthcare coverage, poor communication between the provider and the patient, cultural barriers, provider stereotyping, as well as the lack of access to the provider. So this is contributing to our healthcare disparities issues. Next slide, please. So let me get a little bit more specific as we talk about African Americans and COVID-19. And again, we're focusing primarily on the numbers. As you think about what I just shared with you earlier, the highest risk, and again, this is the comorbidities as well as the poverty concerns, as well as health disparities. I'd like for you to kind of reflect on these numbers that I want to share with you and how this impacts COVID-19 in the African American community. In the United States, African Americans make up about 13% of the population, with 26% of them contributing to the death as it relates to COVID-19. In the United States, this information is based on obviously the updated information that we have now in 2010, and of course this will slightly change in our new census. In Arizona, we make up about 3%, and this again, 3% documented of African Americans in this population. To give you an idea, there's about 7 million people who are in Arizona. 210,000 are documented as African Americans, with about 3% of the COVID-19 deaths being with the African Americans. The problem with these numbers, and this has been documented and identified, that they may not be as accurate because about 12% of the deaths are not identified by race. But once we begin to obtain the accuracy, we can compare these numbers a little bit more. So I want to also share with you, as you can see on the slides, we kind of did a comparison. So again, our numbers are identified that it relates to the Arizona state, but we also see Mississippi having about 38% of African Americans, and 61% of those actually have died as it relates to the COVID-19 death. We also see Michigan, my own home state, 14% African American, and of those who have died from COVID-19, 41%, which is extremely high. Louisiana, 33%, 59% of them who have died from COVID-19, and then Chicago, 30%, and then again, 56% of them who have died from COVID-19. We wanted to give you some high numbers based on the different states and their contribution of the deaths of COVID-19. Next slide, please. So I would like to now have my colleague, Dr. Baker. He'll share additional information on the clinical signs and symptoms of COVID-19.
Thank you, Dr. Allen. I'll start by talking about these next 2 slides and explain the symptoms that could arise when you're sick. So after about 4 days after you've been in contact with someone with the disease, you'll start to notice these flu-like symptoms, including what you see here: high temperature, and the 99% of the patients having temperatures 100.4 degrees Fahrenheit, dry cough, and shortness of breath, which are the 3 major findings when people come into the ER. However, those aren't the only things. There's also loss of appetite, and some people have other things like the soreness in their muscles. Next slide, please. This next slide talks about some of the rare symptoms that you may have heard about, like the headaches, the confusion that people will notice. Your loved ones will notice. And those last 2 at the bottom, the loss of smell and the loss of taste, are very different than other coronaviruses and other viruses for that matter. So that's something that's very particular to this virus. Just remember though, this is a new virus and we're still learning more and more about how it affects us. Next slide, please. But there's some good news. As was previously mentioned, the majority of cases, 81% of them, are mild. If you listen to the early study by the Koreans, they looked at 9,000 positive tests. 20% were asymptomatic. So we probably are looking at more cases that are going to be mild as we learn more and more about this disease. But the part that we worry about are the next 2. Those are those that are severe, which are about 14% of the cases. Those folks start having shortness of breath. When you go to the hospital and get imaging done, they notice that they have pneumonias that are spread throughout both lungs, causing low oxygen. And also about 5% of the cases are critical. And critical means that you start to have the major organs in your body shutting down, like your lungs, your kidneys, and your liver. Of this group of folks, this 5%, the majority of the deaths happen. And that death rate currently is about 2.3%. Next slide, please.
So now I'd like to talk a little bit about best practices. And we are all so familiar with these best practices because we've been hearing them for the past few months. One of the most important best practices is washing your hands. And as stated, 20 seconds. We've utilized techniques such as singing ABCs or happy birthday. And yeah, we do that so that we can keep up with the number of seconds that we're washing our hands. But the most important rationale behind washing your hands is to actually clean them in a thorough manner, cleaning in between your hands, underneath your nail beds, as well as your wrists, so that if you do have some contact of the coronavirus, that can be washed away. We know that, and it's been proven that soap and water, as well as hand sanitizer, 60% or more has been effective. Avoid touching your face, nose, and mouth. You want to make sure that unless you have washed your hands prior to, you do not want to touch your face, nose, and mouth and your eye areas, as Dr. Baker pointed out earlier, because those are open areas where the coronavirus actually enter into your body. Avoid close contact, as mentioned earlier, 6 feet to 10 minutes, 6 feet away, 10 minutes from the time of contact. Stay at home if you are sick. This is very important, even if you work. And I think a lot of our workplaces have actually taken that very serious. If you are working, you want to make sure that you are not in any environment that's going to cause hurt, harm, or danger to another individual. You want to cover your mouth if you're coughing and sneezing, and more importantly, if you have and it's capable of wearing a mask, please do so. We also want to make sure that you want to clean surfaces with disinfectants, and we've actually identified the use of bleach and Lysol, because again, this does pretty much take care of the removal of the coronavirus. Next slide, please. So the mask, this is a very important term I want to talk about. Back in March, we talked about wearing the mask only for those who were affected. And then later, as you begin to look at the CDC and hear some of the messages that they provided, they have now said to have people who are not affected by the coronavirus to wear the mask. And I'll give you a little bit of information on why. If you are a carrier of the coronavirus or COVID-19 and you do not wear a mask, but the person that's near you or around you have a mask on, there's a 70% chance that that individual who has a mask on, that's not the carrier, but you are, will actually have contact with those droplets and actually have some type of effect of the coronavirus. If you notice the young lady who's wearing a mask, there are open areas. So of course those spores can be carried through that mask or around these open areas. If you are a carrier and you are wearing the mask and the individual around you is not wearing a mask, there's about a 5% chance that that individual around you will get the COVID-19 virus. Primarily, again, because you are covering those areas in which if you sneeze or cough, your spores are not going into that individual directly. But yet, because that individual have no covering, there could be an opportunity for them to unfortunately contract that the COVID-19 disease. And then the last one, if both of you are wearing a mask, which is what was put in place just recently, there's a 1.5% chance of that individual who does not have the disease that they would actually contract it. So that gives you an idea why it is so important to wear the mask. Next slide, please. We'll now have Dr. Parker talk a little bit more about when to seek care and or possible treatment. Thank you.
Thank you, Dr. Allen. So I'm here to address what to do if you find yourself feeling ill. So even if you are practicing those best practices, such as washing your hand, as Dr. Allen had mentioned, but you start to have symptoms of fever, worsening cough, shortness of breath, you feel excessively tired, or any other of the symptoms that Dr. Baker had put on his previous slide, then we advise you to call your primary care physician. In speaking with them, they will review all of your symptoms and then direct you on what to do next. Now, if you do not have a primary care physician, or you're unable to reach them because it's after hours or it's the weekend, and your symptoms have worsened to the point that they are no longer manageable at home, we advise you to put on a face covering or a mask and go to the nearest emergency department. So if your symptoms are consistent with COVID-19, then testing should be considered. And one note about testing is that in Arizona, a lot of the large healthcare systems have in-house testing in the hospital, but testing is still limited in some other areas of Arizona. And so we try and make sure that we test those who have symptoms Definitely. Thank you. So now you've gone to the emergency department and they feel that you are too ill to go home. So what happens next? Well, you will be hospitalized. And remember that respiratory infections that were out and about before COVID-19, like influenza and bacterial pneumonias, are still ongoing. So you will be evaluated for many different possible sources of infection. Now we should talk about treatment. There is no cure for COVID-19. You may have heard of other medications that are being used around the country, including azithromycin or Plaquenil. The other name for that is hydroxychloroquine. These medications have been shown to decrease the amount of virus that is within the patient's body. And then we hope that the patient can recover quicker because that load or level of virus has been decreased. There are other medications and clinical trials that are ongoing, but we have to remember that this virus has been with us in the United States for only 4 months. And that is a significantly small amount of time to fully understand a disease and how to effectively treat it. So when you're in the hospital, you will be evaluated to see if your symptoms are worsening. And when your doctor feels that you have recovered enough to go home, you should follow up with your primary care physician. Now, a note about that, it's so important to have a primary care doctor. And so for those who have insurance and have not established care, we recommend that you do that now. And those who may fit in the category of low income, there is state insurance for Arizona, and you can find more information about that on az.gov. Next slide. Okay, so we've talked a lot about statistics, signs and symptoms of the disease and who's at risk, but I want to transition about the importance of taking care of ourselves during this very challenging time. So it's important to continue to monitor yourself for any of those signs or symptoms we've mentioned previously. It's important to get enough sleep and to exercise. If you work from home, we recommend that you take frequent breaks because the day can just run together and that's really challenging. And then also it's very important to continue your scheduled mental and medical health care. We can't forget that all of the chronic diseases that Dr. Allen had mentioned are still ongoing and they weren't halted just because we have a pandemic. So it's important to listen to your body and to check in with your doctor. And most of the time we're doing televisits or phone visits at this time, but to keep up on those things also. Next slide, please. All right, we want to talk about improving outcomes. So definitely continue those best practices. Stay at home if you don't have to go out, but we do understand that many people are essential workers or are still working, so make sure to wash your hands for 20 seconds. And then we want to make sure that the public gets good information. There is a lot of misconceptions and things on social media. So that's what we're doing here today, is giving education. We want to improve resources. So community testing, there, as I said before, are many communities that don't have enough tests. And then also contact tracing, which is essentially a way that we can find out who has been near or affected by someone who has been infected by COVID-19, so we can help stop the spread. And then we want to increase community partnerships, and that's what we're here doing today. So there are other ways that we can advocate for our patients and other policy initiatives, and I will let Dr. Dubonnet explain those later on during our presentations. Thank you.
Just before we move to Dr. Dubonnet, Dr. Parker, one of the questions that's come is whether or not you can spread the disease to someone else if you are not showing any signs or symptoms.
Yes, I think that's a great question. So we do know that there is asymptomatic spread. So people may not have those classic signs or symptoms. And even though they may not be coughing or sneezing right in front of you, we don't know if they've been washing their hands after they've wiped their nose or after they've coughed. And so that virus, just as in Dr. Baker's slide where the virus was over both hands, is still there unless we wash it off. So it is possible for people who do not show signs or symptoms to pass on COVID-19.
Dr. Allen, a question that has been addressed to you is, whether or not a person needs to worry about what their blood type is. Would that make them more susceptible to the disease, depending on their blood type?
No, that's a good question, Dr. Dean. It does not determine the blood type. It does not determine anything as relates to DNA, because again, this virus is entering into the body and it dawns, if you will, into the red blood cells of an individual. So it does not look at the type of blood that the individual may have.
Right.
Thank you.
And Dr. Baker, a question that's come in from our audience tonight, and I want to encourage everyone to please address your questions. We really need your questions because that's the only way we're going to be able to provide additional information to you. This particular individual says they've been shut in for a long time and they're beginning to feel a lot of mental anxiety, and they don't necessarily feel like they have the disease, but they're really struggling with the emotional depression and anxiety. What support could be available to them?
Unbelievably amazing question. The anxiety, the depression that has been noted during this pandemic has been extremely elevated amongst all classes of people. There are providers which do provide telemedicine visits for psychiatry, for the psychologist, psychiatry. Those are still continuing. So please reach out to your primary care doctor to be plugged in. They should have a list of people that can see you as soon as a couple days from now. If not, feel free to call my clinic and we can help you out.
Great. And just before we hear from Dr. Dalbany, I just want to remind Mr. Clovis Campbell that many of these issues that are being addressed tonight may be issues that you want to take back to the council as you speak with the governor as well. And now let us hear from Dr. Dalbany. Right.
Thank you, Yola, for moderating this session, and hello, everyone. Again, on behalf of Mayo Clinic, welcome to this virtual town hall. We're delighted to be here with you and to share. What I'm going to do is to give you a bit of a high-level picture of some of the reasons why COVID-19 is affecting African Americans in a disproportionate way. You've heard a lot about it, so I will go through this at a higher level. Please go through the next 2 slides, please. Thank you. So I think a bit of reflection is in order, because if you look at the history of this virus, it's ostensibly began in a foreign country, came to the United States through international travel. And as I look at my experience and the experience of the population of the United States, African Americans are less likely to travel to countries outside the United States, and yet is a population most affected by this virus. So I'm going to share with you my belief about why this has happened. The other points that have been made is the disproportionate impact on African Americans, and about 30% of the cases in African Americans, of those with race ethnicity reported. These numbers would change over time because as more cases are reported and people collect race and ethnicity data, you'll find that numbers may change. But I will guarantee you that the proportion remain higher than the population represented by African Americans, which is about 13% at the last census. A good example is New York City, actually, where African Americans are dying at 4 times the rate of whites. And this is not a surprise to all of us, because this has been part of lived experience of African Americans. Next slide, please. So why has this happened? It all goes back to social injustice, which creates the situations or environments in which there are differences in opportunities and access to wealth and resources within the African American community, leading to a mix of circumstances that have led to a disproportionate impact. High-risk jobs, people who are in transportation, hotels, stores, selling, we're in business of selling or servicing, service industries, places where people are more likely to get them. And of course, these are also places or jobs in which you almost need to work to survive, and which forces people to expose themselves unnecessarily. Use of public transportation is a very easy way to acquire the disease. Before the stay-at-home order, this must have been one of the ways that people got the disease from each other. Who is more likely to use public transportation is lower socioeconomic population, African-American population, Latino population. It's no surprise that these are the groups most affected. Living conditions are also an important area. Crowded conditions in many of the homes, especially in inner cities like New York, undoubtedly contributed to this. If you have multiple generations who are living in the same family, then you have one person pick it up, come back home, as was explained earlier. Before you know it, someone is sick, and perhaps the whole household has gotten it. And God forbid someone in the family is older, has multiple medical conditions, one of the high-risk conditions, then you have a really unfortunate mix of circumstances that I believe has led to these statistics that we're seeing now. It's also true that if we do the research, we will find, I'm convinced, that you'll find that African Americans are less likely to have protected devices or use them. And again, they also don't have a lot of trusted information, source of information, which may lead to delays, and lack of trust in information people receive may lead to delay in taking up these protective devices. A few other things to keep in mind, as we discussed earlier, a lack of access to healthcare is a big issue. And as this pandemic unfolded, it became really clear that African Americans were less likely to be able to get access to virtual visits or telehealth care. And as Dr. Baker was pointing out, getting access to those telehealth services are important now because you can't really do those physical visits anymore. If you don't have access to the internet and other things, then it's very difficult. Next slide, please. And so I think it's worth reflecting again as to why this is the case. And if you go to, for instance, Office of Minority Health, and you look at the statistics around cancer, asthma, heart disease, diabetes, kidney disease, and many other preventable conditions, you will find that African Americans have the highest mortality rate. I should tell you that as a Black man, I have the highest chance of dying from cancers like lung cancer and colorectal cancer. It has nothing to do with my DNA. It has to do with the socioeconomic circumstances. And so it's no surprise that for COVID-19, you will find this disproportionate risk of dying from this condition. It's just a reflection of what's been in the environment all along. And of course, in addition to this is the fact that there are these higher risk conditions, which are more common in the population. What an unfortunate mix of circumstances provided the perfect environment for this unfortunate occurrence that we're seeing. Next slide, please. So if you follow the sort of the line of thinking, you find the highest mortality rate in African Americans. It's just the tip of an iceberg. If you find it in COVID-19, it was there, and we're just finding this now because, or at least it become more obvious to people because it's in the news and we see it a lot. But you should understand again that this is because of existing policies and conditions that have created the perfect environment for this unfortunate event to occur. And so the unfortunate social needs that have not been met in these communities led to a persistence of conditions that allow for COVID-19 to essentially be very common in these communities and cause this much death and incidents. Now, the one thing that concerns me, and I'm sure in the minds of many people, is that this is unprecedented. We have massive social, economic, and health disruption of fallout. And these are most likely to affect vulnerable populations like African Americans disproportionately. And so we have to ask ourselves a question. What is this going to do to the communities? Is it going to worsen the inequalities that we're talking about now? I'm afraid that that may be the case, but we can do something about it, and we should begin to think about what we should do preemptively before we see the after effects of this. Next slide. So some of the things that we are doing that I want to give a shout out to some of our faculty, Dr. LaPrincess Brewer, for instance, Dr. Mark William, and they've formed sort of a network with community members. We've had some partnerships in place, which made it possible for us to create connections with those leaders, allowing us to communicate important information as you hear it now in real time to people in the community. One of the things that I think was asked at the last session, but also they discovered actually, I give them the credit, is that people in the community said, look, the youth are not paying attention to the social distancing. What do we do? And they were able to craft messaging around that, and the feedback we're getting is that it's beginning to take hold. Translating information to languages that people understand and can follow is important. We've worked with churches to understand the needs, and one of the things that come out of that is important for our audience to realize is that we all have to be ready, because these epidemics or pandemics will occur from time to time, and having preparedness plans will be really important for us for the next occurrence of this. I should also say that Mayo Clinic is coordinating the trial of serum or blood products of people who have recovered from COVID to understand if this is an effective way to treat the condition in those who are seriously ill. So if you recover from COVID, please consider participating in these studies by donating blood to the American Red Cross. Next slide, please. A few things to talk about in terms of what we believe that be important for the policy leaders and governments to do to address these causes of these disparate outcomes that we're talking about. And there are many. I'll just hit on a few of them. One of them is the fact that with more frequent testing that may need to be done as we relax the restrictions, and people have gone positive and they're living in circumstances where they don't have adequate housing for isolation or self-isolation, we need to have the ability for those folks to be able to stay in safe places so other members of the family are not affected. Access to telehealth is going to be really important. We have to collect data on race and ethnicity, because without doing so, we won't understand what's going on, and sharing those data would be important. I worry also about the potential for stigma. If this is affecting African Americans disproportionately or Latino communities, is it possible that they will get stigmatized because of that concern that walking next to an African American person may give you COVID-19? We've seen examples of that already, and it's really important that we address this head on so that this does not become another source of stigma for the population. Next slide, please. A few things to just reinforce: stay safe, stay well, be prepared, be informed, know the symptoms, know where to get tested. When you get it, take action to protect yourself, protect your family and people around you, because every time this passes from one person to the next person is sustaining the virus in the community and making it longer for it to go away. So this is really an important thing for all of us to do. Next slide, please. I want to reinforce what Dr. Dean said earlier. Still arise. This can be overcome, but we can only do so if we look at it in a different light. What I do want to assure you is that all the evidence that I've seen in my many years of research show that these disparities in health are not due to some defect in DNA of Black people. It has all to do with social causes. There may be some DNA differences, but they're not enough to the degree to explain any of the differences that we have seen, others have seen. It has all to do with social injustice. It's important that people get involved. Next slide, please. Next slide. Get involved. Just one more back, briefly. And know about what is going on in your community, because if you don't know what's going on, we really don't know. If you don't know the data, then we actually don't know their disparities. So please get involved in your community, know what your needs are, what's not met. Think about how you become involved to engage in research. One plea I make to people now is that research is one thing that I think has been controversial in our community, and I'm also glad that people are taking this really to heart as well. But experiments are the only way we know about what will work in Black people or African Americans. Without those experiments and studies, we will have no idea what would be effective treatments for folks. So I would implore everybody to take this seriously and participate and be advocates for this research within our communities. Again, despite all the challenges of everyday life, take some time out for yourself, exercise, call your neighbor, call a friend, social distance, know the symptoms, and be sure that when you have symptoms, you get tested and you keep other members of the family and your neighbors safe. Thank you so much.
Dr. Dalbene, even though we're becoming far more educated about how to protect ourselves, we still have social issues to deal with. And this caller wants to know that, I don't know whether it's male or female, but basically she and her ex have joint custody of their children. Mm-hmm. And what they want to know is it safe to take the children back and forth because they live in separate homes?
You know, that is a very, very difficult question. And I'm going to give my response and will invite other panelists to respond as well. The child's relationship with both parents in these arrangements are important. And keeping those relationships together is important. So if video and virtual contact is not good enough, then it's incumbent on the family to make sure that both sides of the family are keeping themselves safe. And within the bounds of the rules that are given by the authorities, I would believe that there's a safe way to do it so the child has access to both parents. But it does mean that both people will need to work together to make sure that safety is maintained. So if one person's exposed and not following the rules, then that relationship will compromise. But I do believe that family is important. It's about a safety and making sure you follow the rules. Driving in your car from your home to the next home doesn't increase your risk, right? Except of accidents, obviously. But again, you should follow the rules of the community where you are.
Dr. Dalbene, I wanted to actually jump in on that. Thank you for allowing us to answer. Just recently in Michigan, many of you all may have heard, a 5-year-old who died from the coronavirus. And so earlier when I shared with you the numbers, or the age range, we are so focused on the older age population or those who are around 50, 60, and maybe even 40 years of age who may contract the disease, perhaps may obviously die. But we are seeing young children, especially with this special case that was identified, letting the media and letting the people know who were, of course, acknowledging the fact that this was not just for the adults, this is also for children. So I think it's extremely important. This is where open communication from both parties should take place. That open communication should be, where are you going with the child? Making sure that individual is in the home, making sure that they're maintaining social isolation, even when they're transporting that child back and forth, because we want to make sure that that child, and both parents are saying the same thing, that child is safe.
Dr. Allen, another question has come up specifically being requested that you answer, and that is, if I go in for testing and I'm turned away, what should I do?
That's a great question, and we had that earlier today. So if you go in for testing, first and foremost, you have to actually contact your primary care provider. I think Dr. Parker did a phenomenal job when she said, if you're seeing that you have some type of signs and symptoms, and those are the list of symptoms, signs and symptoms that Dr. Baker pointed out, you want to be able to contact your primary care provider and ask them, what should you do? If you do not have a primary care provider, then you want to call the urgent care or the emergency room and inform them of the possible signs and symptoms. Once you identify that you have, or they have identified that you possibly have some of these signs and symptoms, then we're going to ask you to come into the hospital in an urgent care emergency room and obviously be tested. But you have to actually exhibit some of the signs and symptoms. We're finding some of the people are actually thinking that they have it or just want to be tested. And because of the low number of testing that we are currently doing, we're asking that you only go in if you exhibit certain signs and symptoms that have been shared with you earlier today. Thank you.
Great. Dr. Parker, A question for you is, if I'm a smoker or a vapor, does this present a higher risk that I might get the disease?
I think that's another good question. So what I would say is, again, there's a lot we don't know about COVID-19 yet. But if you're inhaling any foreign substance into the lungs, that will cause irritation of the lungs itself. And we think that it could cause some damage, and then it might be harder for you to fight a viral infection. So we don't know for sure, but anything that you're inhaling in, so this is vaping, smoking marijuana, or cigarettes, could put you at higher risk for serious complications of COVID-19.
Thank you. I do want to remind our participants that I am addressing many of your questions that you have written. I'm not calling your name, but I am trying to get to your questions. Dr. Baker, does inhaling steam into the nasal passage kill the virus? Some information states that the virus remains in the back of the nasal passage for several days before symptoms of infection begin to show.
That's actually inaccurate. Inhaling steam would be very dangerous to do because you can actually burn your nasal passage. The virus, once it touches the mucosa, it finds its way in and works its way to your lungs rather quickly and builds up enough of the virus within 3 to 4 days that you have the infection. So trying to breathe in steam won't affect the course of that disease.
This question says, what advice would you give if someone is fasting at this time? And could fasting cause a problem? Dr. Allen, we're going to let you try that first, and then anyone else can chime in.
Thank you very much. So first and foremost, when we fast, oftentimes we will share with you to contact your doctor. Fasting can be anything as of not eating anything all day, not eating anything for days, or fasting, and we call it the David fast, eating only a certain time of day. It is highly recommended, A, you contact your doctor, B, and we haven't talked a lot about this, but build up your immune system, because again, when you're building up the immune system, you are fighting off the virus. So we're not telling you to stop doing the things that you usually do or are scheduled to do, but we're asking you to contact your primary care provider so that if you choose to do it, this is something that is applicable and able to allow you to still live a healthy life, but yet not allow you to be more prone to the infection.
Dr. Dalbany, the question is, does this pandemic have anything to do with the 5G network?
No. It does not have anything to do with 5G network. I would take that to mean smartphone networks.
Yes.
But the piece it has to do with 5G network is that having access to technology to be able to, one, get information, have visits with your providers or clinicians is critical. And not having those resources makes it harder to be able to get consultation about any symptoms you're having, get advice, and therefore respond in such a way as to get tested and protect yourself and those around you. So it's important. Well, having access to information and technology is crucial for our communities. And this is one place that is important for government officials to pay attention to. I think this pandemic has shown that it's not just enough to think that people will do that, but also try and put in policies that will enable people to have access to technology, especially for emergencies like this.
Thank you. Dr. Baker, you said earlier that there was no cure for COVID-19. Does this mean that if you had it and you get better, that you still have the disease?
No, what that means is usually when you have a disease, that we have treatment for, or antibiotics for, or antivirals for, we can give you the medicine and give you enough of it to really drop your load down to an undetectable level. This is not that kind of disease. If you get it, we have to allow your own body to fight it. So therefore, once your body does fight it and you get better, there's a period of approximately 2 weeks, maybe 3 weeks, where you still can be asymptomatic and shedding. But after that point, you should have built enough antibodies up to fight the disease in the future. However, we don't know enough about this disease to know that that's the case. So we're learning as we go along.
So tell us again, Dr. Baker, if you have symptoms of the disease and you do think that, and the person's been tested, are you advising that we just eat right and get plenty of rest? What are you advising me to do?
Well, now there's a test that's coming out that we can test people that have gotten better to see if they have built up immunity or built up antibodies to it. But again, the idea of eating healthy is something that should happen even far before this hit. But eating healthy will help you get through this a lot better. So maintaining your vitamins, eating healthily, continue your exercise. Once you feel that you have enough wind after you've had this disease, go for a walk, cover your face, go for a walk. It's time to go back to trying to be as normal or your new normal as possible.
Dr. Parker, I know that you talked a little bit earlier about the virus staying on the surface. Can you tell us a little bit more about how long the virus does stay on a particular surface? Or do I need to worry about washing everything right away? Sometimes emergencies just won't allow us to do that.
Right. So from what we have, the studies that have been done, it seems that the virus will stay on surfaces for about 3 to 4 days. And so, we keep saying it over and over again, but it really is important to continue washing your hands as often as possible. So when you leave the house and, you're picking up mail, packages, you're exchanging money at the grocery store, it's important to wash your hands or sanitize with hand sanitizer if you have it. So we think about 3 to 4 days is how long the virus will last on those surfaces.
Okay. Dr. Allen, a question came in about African Americans being prone to having a low vitamin D count. And if an individual has a low vitamin D, does this make them more susceptible to the disease?
I'm getting the tough questions, Dr. Dean. No, it does not. And actually it's interesting that, and jump in on my colleagues, please do so. It's interesting that oftentimes we do hear that African Americans have low vitamin D, and it's not just African Americans, everyone pretty much has low vitamin D. But again, the vitamins, DNA, the blood type has nothing to do with the fact that, of course, the person is more susceptible. It is primarily the comorbidities, basically the internal, which is the hypertension, mainly the respiratory. I mean, that's a big focus there, and then also diabetes. So it doesn't have anything to do with the level of the vitamin D in your body. So, thank you.
Righty. I'm going to read this one from a participant. What if you suffer from blood clotting factors, protein 5 deficiency and protein C deficiency? Contractors of COVID-19 are suffering from blood clots. How do we empower ourselves to ensure healthcare providers who don't look like us address this issue appropriately?
Yes.
Go ahead, Dr. Parker.
I'll take that one. So it sounds like this person is asking if I have a pre-existing condition, which includes blood clots, am I at higher risk for COVID-19? Now, some people have heard in the news and in some studies that we are seeing patients develop blood clots, so clots in the legs or clots in the lungs when they have a severe respiratory infection due to COVID-19. And we think that, as we've been talking about, the body has to really take over and fight the infection, and it causes an overwhelming inflammatory response. And any inflammatory state that a person is in can put you at higher risk for blood clots. So, there are some clinical trials, and one will be started at Mayo Clinic too, to kind of delineate how much effect this is having on patients and what to look out for and how to treat and preempt this, but we just really don't know enough yet.
Okay. All right, this is a long one, but listen carefully. And first up, anyone. My mother is in a nursing home. I found out today that 2 residents have tested positive. I was asked if my mom tests positive and her symptoms become severe, if I wanted her transferred to a hospital and placed on a ventilator, or remain at the nursing home and placed on oxygen and provide palliative care. I choose to remain at the nursing home. Is this the best choice? I'm not sure any of us can make that decision for some.
That would be a personal choice. There's a whole lot that goes into that.
Yes.
It's hard for us. We're not going to really make medical decisions for you, but the advice I would give you is whatever is decided, the end of life decisions that the patient has made is what you should respect. If they said they want no extreme measures to happening, which includes intubation or putting a tube in to breathe for you, just respect that. And do understand, though, that someone is severe, or if they have no way of isolating a person, it may be just advantageous to get them out of that setting so that they don't affect other people. But as far as treatment or forcing her to other treatment, I wouldn't recommend it.
I would also mention that there should be some kind of healthcare system, a healthcare provider or nurse that is there at that facility at the nursing home who can evaluate that person's mother and then help them make decisions on, if they're showing signs or symptoms and what the next steps are. And most nursing facilities also have a medical director that's a physician, and that's a resource.
Dr. Dalbany, the interest still remains when we talk about someone that might have experienced some of the symptoms, but they're not really ill yet, and so they're still at home. But in the African American community, many of us live in congested areas and sometimes multiple families in that same dwelling. How do we take care of that individual and basically put them in a safe environment there so that the rest of the family doesn't get it? How do you quarantine in the same house?
Yeah, and I think this is a very, very, very important question for the African American community. First of all, I believe it's important to be able to provide expanded testing to the population, especially if we're going to be relaxing these restrictions. Because if we don't do so, then it's harder to be able to give people the opportunity or empower them to take those protective measures. In this particular circumstance, we know of communities and even governments who have provided temporary housing to allow people to go to somewhere that is safe. I have had examples of families who have the means to say, well, if you've been exposed to someone who have symptoms, then you just go to the next room on the 3rd floor, like where I am, right? I'm on the 3rd floor of a 3-story or 4-story house with kind of basement, and the rest of the family can still be safe. But if you don't have that luxury because you're in an inner city apartment with multiple people in it, then staying there simply exposes the rest of the family to COVID-19. God forbid if you have one family member who has multiple conditions, as we've talked about, like diabetes, hypertension, heart disease, and they get the disease, then they're at higher risk of dying. If you cannot isolate yourself and cannot get tested, which I hope you can and should, then the best you can do is to wear a mask, stay in a confined space. If you have the ability to have a separate room, that's what you should do. And if you come in contact or near contact with other people, then make sure you're wearing a mask and keep your hands sanitized at all times. But I have to tell you, if you're in those sort of circumstances, I believe those are the perfect circumstances that have led to the spread of the virus in these communities. All I can say is do the best you can. If you cannot social distance, you should look for help to be able to stay somewhere else to the extent we can. I would encourage our government officials to look for ways to provide safe places for those who are in circumstances like this, so that we can help to limit the spread of the virus within the community.
Thank you.
Dr. Dean,
Yes.
can I just chime in? I know that Dr. Dubonnet has mentioned about government assisting on several occasions. And right now, if people here in Arizona need some types of assistance from the government in regards to COVID, they can also go out to the DES office, at the Arizona State DES office. There's a lot of services, a lot of money has been put forth to assist people with those types of things that he's just talking about. So there are some resources available, and people should be able to, and we are making sure that people have resources so that they can utilize it quickly as well.
Oh, perfect. Thank you, Mr. Campbell. That's very critical. And I know that I believe a list is also going to be provided or is being provided regarding the testing sites. So that will help many individuals in the event they need to go for testing. A question. I have a trait of sickle cell. Am I considered high risk? Dr. Baker.
I had to think about that. I would have to defer to my colleagues because I don't know the answer to that.
I would have to say that, we do not know. I mean, I have not encountered a sickle cell patient, here. In Arizona, we are 3% of the population. And so they may be seeing that in other areas that are more densely populated with African Americans, such as Atlanta or Chicago, Houston. But I have not seen anything come out recently in the literature about sickle cell patients and how susceptible, more or less, that they are to COVID-19.
This is Dr. Allen. I'll jump in and say, no, we do not have evidence, and that's why we're encouraging people to be more involved with research, but we also do more what we call comparisons. So if this individual who has sickle cell, they've had some encounter of influenza or some type of other viral infection, they could kind of give an idea of the opportunity of possibly getting the COVID-19 as well. But I would agree with my colleagues that there isn't any testing or any research on this yet because of the fact that this disease is very new, 4 months old.
I mean, I just add very briefly,
Yes.
So if you have sickle cell anemia, which is the more severe form, obviously if you're sick for any reason at all, and or you're dehydrated or a number of things, so your blood oxygen levels drop, you are more likely to sickle. And so it is conceivable that if you have sickle cell anemia and get COVID-19 and become sick, like the more serious cases that Dr. Alan Baker talked about, then you're likely to potentially have more severe complications. Now, we don't have the data, but it does mean that if you have sickle cell anemia, you're probably one person who wants to try and avoid getting COVID-19 at all costs. The traits should not increase your risk. It's only in very extreme circumstances, like very high altitude, that you're prone to sickle. And those circumstances are unlikely to exist, except perhaps in those who are very sick anyways. So I do not believe that the trait will increase the risk, but sickle cell anemia certainly may increase your risk of dying.
Thank you. Another question that has come forward is, if I've had both a pneumonia and a flu shot, will both of these vaccines protect me for this against COVID-19?
No, it's a totally different virus. It won't protect you against getting the disease.
So that was just for the flu and for pneumonia.
That's correct.
Okay.
But I do want to add one thing, though.
Yes.
And I think implied in Dr. Baker's response is that the fact that we don't have vaccines for vaccine for COVID-19 does not mean that you should not get the vaccines. To the contrary, it is important that you get the other vaccines, because getting COVID-19 could increase your risk of getting pneumonia. And if you don't have the pneumonia vaccine to protect you, it may increase your risk of complications. And so, although a lot of the preventive measures that we typically recommend to people are currently on a pause because of social distancing, it's really important for our community to understand that a lot of causes of death are preventable. And I speak of this because I'm also a member of the U.S. Preventive Services Task Force, where we make recommendations for preventive services. And we know that African Americans are amongst a group that are less likely, or perhaps at least likely in some instances, to receive these preventive services. So it's really important, and if I may give this shout out to people, that please look at what preventive services you are supposed to get, whether it's cancer screening, vaccinations, counseling, and other things, and ensure that you work with your doctor to work on those preventive services, because it can help to increase the life or prevent death.
Thank you. Dr. Allen, there seems to be a need for a little additional clarity regarding wearing the face mask. So were you saying that if we, no matter when we leave the home, of course, we don't need it driving in the car if we're alone, but that we should wear a face mask?
Yes, Dr. Dean, I appreciate that question, because that's a question I've been asked several times, even outside of the panel. When you leave your home, it is highly recommended that you wear a face mask, whether you have the disease or think you have the disease or not. If you are riding your bike, if you are running or walking in your neighborhood, I want you to imagine a walker or a jogger walking past you, and without a mask or protection, if you will. As you walk past that individual, if they're less than 6 feet away from you and they sneeze or cough, what protection will you have immediately at that time? None. If you are going to the stores, and we've seen people with and without them, again, you are protecting yourself. I broke down the percentages, and as I've mentioned earlier, your mask is actually protecting you, obviously, if you do not have the disease. But of course, if someone does have the disease and they chose not to wear a mask, look at the protection that you're putting in front of you to block that time. So yes, it is encouraged to wear a mask. In my case, I usually put a mask in a Ziploc bag, put it in my purse, just like it's obviously a part of me, put it on when I walk out of my car and go to take care of any of my business, and then take it off, put it in my Ziploc bag, and then of course put it in my purse and go on. So yes, it is recommended.
Great. Well, I assure you that there are far more questions that we've received tonight than we will be able to answer, but we will collect the questions and answer them, of course, and include the response in our report. I want to also take time, I think we have a little under 10 minutes left, and give time to Dr. Halyard and Marion Kelly, of course, if they would like to make additional comments. And before Michelle, if there's any of the doctors or any one of you want to make maybe a 60-second closing statement, and then Michelle will take over.
This is Dr. Allen. I do want to share something. 80% of my work is research. And we know that we are underrepresented when it relates to research. Many of you all on this call and Zoom meeting have heard us say so many times that we do not have enough evidence on several things that we are recognizing. Sickle cell, which is extremely prone to the African American community, hypertension, respiratory issues, diabetes, all of these are things that are very prevalent in the African American community. What we would encourage you, and particularly in my case, in research, is that if there is an opportunity for you to be involved so that you can not only protect yourself, but also protect those after you. I think Dr. Dean said it very well, protecting those who are around me, who I love, my children, etc. We are encouraging you to please get involved. I think Mayo has done some research, as well as Banner and other healthcare facilities around the area. Thank you.
I think the comment that I would make is that we gave you a lot of information and we want you to be informed. We do not want you to live in fear. So take precautions. But remember that about 80% of patients who contract COVID-19 have mild symptoms. And even though there are many patients in our country who are very ill, who are in the ICU and who are dying, it is a smaller percentage. It doesn't mean that we shouldn't take it seriously and do all the best practices, but we should not live in fear.
Great, thank you.
I would just say one thing about testing. I know that's a big deal for a lot of people. The amount of testing that will be happening over the next 3 to 4 weeks will be largely expanded. Please keep on the lookout of your social media and other sources at where those places will be. And there's 2 types of tests. Just rely on the provider that you see to give you the proper test. But you will be seeing a lot more of this locally.
Dr. Balbany, 60 seconds.
6 seconds. Yes. So I want to again reinforce that there's a lot of hope. There's a lot of opportunity for us to prevent preventable deaths, including COVID-19. Many of the causes of disparity, if not all of them that I know of, are due to things that we can prevent. So make sure you look at your preventive services or things that your doctor should recommend for you, whether cancer screening or other things, vaccinations that you're due to receive, and get those things. Understand what is needed to keep yourself healthy. The diet is really important, physical activity, meditation, paying attention to your psychological strength is really important, and take the steps necessary to make sure that you keep yourself healthy and in good spirits. And may God be with you.
Yes, Mr. Campbell, 60 seconds before Dr. Elliott takes over.
Sure. Just to remind people that the state of Arizona is doing everything it can to ensure that our citizens are as safe as possible. In addition, they're putting as much resources as they can, probably more than any other state in the country right now, as they need to get it out there for people. So keep in mind that there is information. Continue to watch the Arizona Department of Health Services website to get updates constantly about what's going on within the entire state. I'm Reducing and his team are doing a great job. Thank you for putting this together, and we appreciate everything we've done today.
Great.
Well, in wrapping up, I'd like to thank everybody on the panel. I think you gave wonderful information. For those of you who've been watching, we thank you for spending the last 90 minutes with us. We hope that we've accomplished our mission about providing credible information to you about COVID-19. We will make a link available to those of you who are registered for this session, as well as the session at noon, so that you can pass along this to people who maybe couldn't attend tonight. We've had close to 700 people today, so we've reached out to a lot, but there are many more who need this information. So the charge that I leave to you are twofold. One, spread the information that you have learned with others who could not be here today, because you can help with this pandemic. You can take the information that you've learned and give it to your loved ones, your family members, your social networks, so that they are well informed. I want to talk a little bit about a term we're beginning to hear: quarantine fatigue. I think all of us are tired of being inside. All of us want our lives to return back to normal, although we don't know what that's going to look like. I know I want my life to return back to normal. I'm tired. But we have to keep doing the things that we talked about until this pandemic is under control. Social distancing, wearing our masks, hand washings. All of these things are very important. And sometimes we feel helpless in this situation, but these are the things that you can do to try to keep yourself safe, your family safe, your community safe, so that we can actually reduce this pandemic. And the last thing I'll say before I'll turn it over to my colleague, Marion Kelly, is there's a lot of stuff that's out there. Some of it's credible, some of it is not credible. Before you even contemplate taking medications or potions or anything to try to fight this pandemic, please ask your healthcare provider. Please ask someone that is credible and knowledgeable, because we don't want you dying from something that you think may be a cure to COVID-19 when there's no evidence behind it. So with that, I'll turn it over to Marion Kelly to take us home.
I want to leave you with 2 thoughts, and thank you again for tuning in to this a very different platform of a town hall meeting, but one that was extremely important to have. I think that we always need to reflect on our past whenever we're thinking about how to get through something. And I'm reflecting on 2 points. One is I am the 7th child of 8 children. I have 5 brothers. I have twin sisters. My brothers and I fought as we were growing up. That was preparation for me if I ever got in a fight outside the household. Fortunately, I didn't have to, but I was prepared for it. We will not be prepared for it, for this fight against COVID-19, if we loosen up the idea of quarantining and keeping ourselves distant from other people. It's important that we follow that if we want to win this fight. The other thing that I want you to reflect on are the challenges that you've had in the past. They are exactly there in the past. COVID-19 will also pass.
Thank you so very much. And George Dean from the Greater Phoenix Urban League wants to thank you, Dr. Halliard and Marion, for making this program possible this evening, and extend their support as well, because together we make a difference. And so as we bring closure to today's town hall, we want to remind everyone who has called in this evening to participate that we are a resilient people. And when we learn and cloak ourselves in wisdom and knowledge, we can survive. You can remember the words of President Barack Obama. He said, yes, we can. We faced adversity before, and we can handle it now. And it's all about preparation and learning how to take care of ourselves. We still have a great future ahead. Yes, we can. Thank you so very much for joining in tonight. May God bless each one of you, and we look forward to sharing with you again. May God bless you. Good night.